This is Dubai Eye 103.8.
Worldwide, 50 million couples can't have children without medical help. A study in 2017 revealed that sperm counts among men in the West have more than halved in the past 40 years and are currently falling by an average of 1.4% a year. Too often, we focus on women when we discuss fertility, but medical experts say that it's more often due to a problem with sperm rather than eggs. But this afternoon, we are going to take the first step in changing that because we are joined by Dr. Bahira El Gayushi. She is the IV consultant and fertility expert at the Health Plus Fertility Centre. Thank you for joining us again, Dr. Bahira.
Lovely to be back here again.
A pleasure. Now, in your experience, how common is male infertility nowadays?
Actually, male infertility is quite a common problem, unbeknown to most. And I think there's a concept out there that most of fertility problems are related to women. But if the actual statistics tell us that male infertility can be responsible for up to 50% of infertility causes. Now, this is actually divided into sole male infertility, which can be the only problem. That can be in the region of 20 to 30%, and the remaining 20 to 30% is due to combined factors. But in total, male infertility is responsible for 50%.
Is it a particular problem in the UAE, or does it not change as far as across the world?
This is a global problem. It is worldwide, and we've noticed this with the WHO, where it's revised its criteria for measuring and assessing male infertility. And that's through doing a semen analysis. So the parameters from the 80s to the 90s have actually dramatically dropped. And the latest WHO criteria have made major adjustments. And this is probably due to the many impacts. It's multifactorial, which I think we'll discuss a bit later on.
How do you measure infertility? At what stage is a man considered infertile? Because my understanding is that if you're having IVF, a man only needs to have one sperm that works in order to make a baby.
Well, not just in IVF, in nature as well. All it needs is one sperm, one egg, and one baby. We say infertility is the inability to conceive after either 12 months or 6 months, depending on the type of infertility, whether it's primary or secondary. Once that happens, then the couple have to be investigated together as one unit, not concentrating on one without the other. Unless there is a known problem that's there before a hereditary problem, then investigations can actually start earlier for the couple. And what we will notice is that the rate of infertility on both of them is there's a big burden there. And for males, all they need to do is one test. That's a semen analysis. That will give us an idea and parameters. And I don't like to call it infertility. It's more subfertility. It's being subfertile. And there are multiple causes. A semen analysis, there are several parameters. We look on the count, the concentration, the number of normal forms, that's called morphology, and the progression of the sperm. These are several parameters within one test that we check.
What are the main causes for infertility in men?
You know what? I don't think you're going to be very impressed with my next answer, but in medicine we call that idiopathic, which means we don't know. It's unexplained.
Oh, wow.
In most cases, it is unknown why there is a subfertile problem in a man. When it's clear, it's very clear to us. Then we can say, oh, it's because of a chromosomal problem, a surgical problem, a hormonal problem, and these are very clear. In the majority of cases, for 50% of cases, we really don't know what the problem is.
How about in the other 50% of cases? Are there circumstantial, so for example, if somebody's overweight, are they going to find it less easy to conceive? If somebody smokes a lot, are they going to find it less easy to conceive?
These are the environmental factors and our lifestyle factors which will affect all men and will give a varying degree of subfertility. Also, the way to define it, we never ever take one sperm test and say, right, that's it, I'm saying you're subfertile. What we usually say, we recommend 2 tests at least 4 to 6 weeks apart before we can actually say that there's a problem. And we look at it and we try and decide what the problem may be. Does lifestyle have an effect? Actually, yes. Environmental factors, lifestyle factors. I think some of the most important issues is smoking. Smoking is one of the most detrimental factors to everything, for men and women, even passive smoking. We mustn't underestimate the impact of passive smoking as well.
We're joined in the studio by Dr. Bahira El Gayushi. She's an IV consultant and fertility expert at Health Plus Fertility Centre, and we are discussing the sperm shortage.
The doctor will see you now.
So, Dr. Bahira, thank you so much for joining us. And I know that personally, I know so many couples who struggled to have babies, and more often than not, that actually has been down to the husband's sperm count rather than sort of problems for the future mothers. And it turns out that my anecdotal experience totally seems to fit in with the worldwide figures. Male infertility is on the rise, and the World Health Organization is calling for more research on the topic. And I suppose the reason why it's so important that we get to the bottom of male infertility is not just because it causes problems with making babies, but because it really affects male psychology.
That is going to be a very difficult question to answer, because subfertility as a whole has a great psychological impact on the couple. More so on the female partner than on the male partner. We do have few studies that suggest there is a psychological impact on men who suffer with subfertility. The problem is they don't talk about it. It's not only that, but it's a taboo. Have you ever seen, a couple of guys sitting together discussing their sperm and their sperm parameters and how they may be infertile? They keep it into themselves. It can lead to anxiety, depression, but it could be subclinical, and because there's a sense of denial as well. It may not be linked that the reason for this is due to the subfertile problem. Work pressures, life pressures. Oh, the partner is the one who is doing more of the pressure, and he's more anxious about her well-being more than anything else. And I think men tend to put up this very brave front, but actually inside it does have an effect, but more so on women than it does on men.
That's so interesting that it does. So even if a man is told that he's subfertile, are they resilient to that news, or can it have a massive impact on them?
I think they link it to virility. That's more where the impact comes on. I think men in general are okay with not, having children. It's not such a big impact when you tell a woman you will never have children, you can't be a mother. It decreases a little bit from the sense of femininity. With men, it's sort of like, oh, well, that's okay, that's fine. I've got cousins, I've got nephews, I've got brothers, whatever. The impact is there. I think more of the impact, and it's going to be very difficult to find the true impact because it is associated with the virility of the man. Does that mean that I'm not man enough? Does that mean I have a problem with being able to carry out my functions? All of these things are more that. But of course as well, having in certain cultures is important to have children and have extended families. And it's more cultural pressures, family pressures. Where are the children? Why haven't you conceived? And of course, most of the time, the pressure is put on the female partner. Is it her fault? Go and get checked. And there's a whole tense situation. I think it's more cultural than anything else. I think if you leave couples to their own, they'll be able to sort it out, because stress does have a big role in making this problem a bit more complicated, compact, and difficult to manage.
So if you have a couple who come into your clinic and the man has a low sperm count, and you look at him and he seems to be a little bit overweight, are there suggestions that you would make to improve, for the guy to improve his health, and that could have an impact on improving his fertility?
Most certainly. That's number one and the first port of call. Lifestyle advice. If you're overweight, reduce the weight. If you're a smoker, if you can, quit smoking. If not, I request that they smoke less than 5 a day. And shisha, I have to say that shisha is smoking, because sometimes I ask my patients, do you smoke? No, just shisha. Honestly, it is smoking. So shisha has an impact, midwech has an impact, and smoke has an impact. That has to be eliminated, if not reduced. Leading a healthy lifestyle with lots of exercise, making sure that they don't have hot saunas and hot baths, and they don't have tight trousers and underwear. Very simple things, actually, in actual fact. And then, of course, we can add the supplements that help and sustain the production of sperm. All these are very simple things, and sometimes that's all you need to do.
So you mentioned supplements there. How about medicines? Are there sort of clinical medicines that make people, produce more sperm? Make men produce more sperm, I should say.
The medicines that are available are targeted to the problem. If there is a specific hormonal deficiency, then we will give hormone replacement therapy. If there is a problem that is associated with that, it's mainly for that. But as in a miracle drug that will increase sperm production, there isn't that as such. Mainly it's just general vitamins and supplements, antioxidants and replacement hormones in certain situations.
The doctor will see you now.
Now I am joined in the studio. We've kept her with us. It's Dr. Bahira El Gayushi. She is a fertility expert at Health Plus Fertility Centre. Thank you so much for staying with us, Dr. Bahira.
It's a great pleasure.
We've had loads of messages coming in on 4001 and on the free messenger app. There's one here from Vivek, who is in the marina. He says, my wife and I have been trying to have children for 3 years. They've tested her and said nothing was wrong, but now suggest that I should do some tests. I lead a healthy lifestyle, but I am worried that I might be the reason we're unable to conceive. Do you have any ideas?
Yes, we always say with subfertility, we like to treat the couple and investigate the couple as a unit and as a whole. So I would actually advocate that he has a semen analysis test as soon as possible. And if anything, it will probably be normal because there is something called unexplained infertility, but it just ticks the box and gives reassurance that there is something that actually he is okay. But I do have to stress the fact, 3 years of trying, I think it's about time that they go and see a fertility expert to look into this more and investigate more. It may be a small thing here and a small thing there that needs tweaking, but most certainly it's time for that test for him.
He touches there on the issue of the sort of blame game. Do you find that couples can fall into that trap? I find even with the language of infertility, it's quite difficult not to say it's someone's fault.
It's not usually a blame game. It's automatically we think, oh, it's the woman's fault. And actually women themselves say, no, it's fine. It's my fault, not him. And occasionally if somebody was married before and he has children, they'll say, oh, but he's got children. And she may have been married before as well. And I'll say, but you've got children as well. Or if it's secondary infertility, meaning that the couple have both had children together and they can't conceive now, he'll say, I don't need to do a test. I've already had children. And I go, yeah, but you've had it with your wife and she's brought these children as well. So they have to be tested as a unit. I don't see the blame game a lot, but there's a lot of stress and tension in the relationship.
A message here from John in Jumeirah saying, how much does our current environment affect male infertility, like using laptops and electronics? Is there anything we can do to address this?
Environment has a big factor, and over the years it's been responsible for the decline in the sperm parameters and the increase in male subfertility, mainly the smoking, the atmosphere, the type of food that we eat. Laptops is actually a very important factor, especially in young boys. Now, people will think, oh, it's because of all these electromagnetic waves and the ultrasound that comes through it. It's actually, for boys, a very different issue. Now, when you put the laptop on your lap, there's a whole load of heat that's generated from the bottom of the laptop, and that is directed towards a very sensitive area. For men, it's very important that their genitalia is actually quite aerated and exposed, and that's why it's outside the body, not inside the body. And that's why we advocate no hot saunas, no hot baths, no tight underwear. So what are we doing? We're putting these laptops that generate a huge amount of heat for maybe hours on end, and we're actually frying away the sperm.
Gosh. That's quite emotive language. Goodness me. There's a message that's just come in here. Thank you very much for getting in touch. 4001 or the free messenger app. Do join the conversation. This person says, in my opinion, male fertility increased worldwide because of our daily consumed foods, which are not organic. How about that? What do you think about that, Dr. Bahira?
We don't have any studies to prove or disprove that, but does food have an impact? I certainly think so. Now, if we look at the type of food that we have, the fast food, the processed food, all these preservatives that we have, they have an impact. These are all toxic things that enter into our body, and the sperm cells and the egg cells are very sensitive cells, and anything that goes in the body will have an effect on them on time and generation after generation. Is organic food alone enough to reverse the effect? I'm not quite sure. I don't have the evidence for that, but it's certainly not a bad thing to do.
And I'm joined by Dr. Bahira El-Gayoushi. She's an IVF consultant and fertility expert at Health Plus Fertility Centre, and we are discussing male infertility. And there's another message that's just come in here. We've had a lot of messages on 4001, or you can use the free messenger app. Do feel free to remain anonymous. I understand this is a very sensitive issue, and indeed this message has got no name. The man says, I am 41 and I'm getting married later this year. Does male infertility increase with age, and is there anything I can do to prepare for trying to conceive, as my wife and I are very keen to have children?
You know, we've always said that age affects the woman more than the man, and if anything, a man can reproduce until death. But there's been recent studies to show that the parameters of the sperm are affected. They're reduced. They don't have infertility and they're not subfertile, but certainly the quality of the semen is changed. Now, why is this? It's probably, again, due to the environmental factors, the toxins that we have, and the main cause seems to be associated with increasing sperm DNA fragmentation. What that means, in effect, is that the chromosomal material and the genetic material in the sperm seems to fragment a bit and is not of the same quality as, say, a 20-year-old man. So I'd reassure your sender of the message that he's probably okay. A healthy lifestyle, if he's smoking, to stop that. If he's overweight, to exercise. It won't hurt to go and have a sperm check if, he's really that worried. As long as he's healthy, there's no history of measles, mumps, or diseases or major surgery in that area, then he should be okay.
How much does it cost to have your sperm checked?
It will vary from centre to centre, and it's it's different from a fertility centre to a general hospital, because fertility centres look in more in-depth parameters than it is. It's very difficult to comment on that.
And how about for women and men? If you are, say, you're 40 and you're about to get married and you want to have children, would you recommend that both individuals just go and get tested straight away, so you know, for example, as a woman, you know what your fertility is? Because it is possible to calculate it, isn't it?
Well, if you're 40, it won't hurt to have what we call a fertility assessment. And what that is a sperm check for the husband, and for the wife, a couple of hormones and an ultrasound scan. It gives an idea of what the status is at that moment in time, just in case they're delaying childbearing for a little bit, and not to get nasty surprises. I don't like to put a lot of pressure and burden on a beginning of a married life, but if you suspect that something is not quite right, by all means go and get it checked.
Fantastic. Dr. Bahira El-Gayoushi, you're an IVF consultant and fertility expert at Health Plus Fertility Centre. Thank you so much for joining us. We really appreciate your time.
Thank you.
This is Dubai Eye 103.8.
This is Dubai Eye 103.8.
Worldwide, 50 million couples can't have children without medical help. A study in 2017 revealed that sperm counts among men in the West have more than halved in the past 40 years and are currently falling by an average of 1.4% a year. Too often, we focus on women when we discuss fertility, but medical experts